is derived from sneha, which means oiliness, lubrication and viscidity. Thus, snehana involves application of oily substances. In snehana therapy, the oily substances are administered internally as well as externally. The internal administration of oil is known as Abhyantara Snehapana, and external application is referred to as Bahya Snehapana.
When sneha is derived from plants, it is known as Stavara Sneha. One example is the taila or the oil derived from sesame. When the oil is derived from animals, it is called Jangama Sneha. Ghrita or ghee obtained from the clarified milk of cow or buffalo is considered to be the best of all snehana substances. It has the power to effectively assimilate the properties of other substances without losing its own qualities. Apart from ghee, the other commonly used sneha substances are taila, that is sesame oil, vasa, that is muscle fat, and majja or bone marrow. Usually ghee processed with medicine is used. This has the ability to yield better results in sneha procedures.
Abhyantara Snehapana is mandatory in most cases. It is indicated for persons who excessively indulge in sex, physical and mental exercises, and consumption of alcohol. It has to be followed in the case of patients who are underweight, deficient in blood and semen, and those who are in a state of constant worry. It is also indicated for the aged and the children. Internal snehana is mainly performed in vata disorders. Abhyantara Snehapana is contraindicated in the case of patients with excessive kapha and meda, that is fat. Patients suffering from ascites, diarrhea, throat disease, and those who are weak, unconscious and intoxicated are not given internal snehana. It is also contraindicated for pregnant women, abortion, and for patients who are currently undergoing vasti, nasya and virejana therapies, and those who have a low appetite. Selection of a suitable sneha is extremely important in Purva Karma. The best suitable sneha is selected depending upon the nature of disease, the season, physical and mental constitution of the patient, and the predominance of the concerned dosha. In the case of internal snehana, the dose of sneha has to be determined carefully according to the digestive power of the patient. After ensuring that the food taken in the previous day has been digested, the patient is given Abhyantara Snehapana. The commonly accepted method of Abhyantara Snehapana is the oral administration of oils.
The patient has to be prepared for Abhyantara Snehapana. A day before the commencement of Snehana therapy, the patient is given limited quantities of warm liquid food which do not produce excess moisture in the body. Patients with irregular appetites have to be given buttermilk or dry food articles to create dryness in the body. This process, known as rukshana, makes the snehana more effective. Rukshana is also recommended in the cases of patients with excessive muscles, excess fat, and kapha. Abhyantara Snehapana can be administered in any of the three ways, depending on the disease and the body constitution of the patient. The chosen sneha could be administered without mixing with food. Such a method is known as Acha Snehapana and is considered to be the best because of its immediate effect. Some patients may have a natural dislike for Acha Snehapana. In such cases, the sneha can be mixed with other food for easy intake. This method, known as Vicharana Snehapana, is to be followed in the case of patients with Mridu Koshta, that is, low digestive power. It is also preferred in the case of alcoholic patients. In the case of children, the old and the weak, another method called Sadhya Sneha can be followed. Here, the sneha can be laced with palatable food items such as meat soup or gruel, with sesame seed powder or milk, or preparations containing ghee or curd. The sneha has to be administered early in the morning on an empty stomach after the patient has satisfied his natural urges. After the completion of sneha, the patient should be made to consume warm water to help digestion of the sneha. After a few hours rest, the patient can be given a small quantity of gruel if he or she is hungry. The administration of Abhyantara Snehapana has to be continued by increasing the dose for a period of 3 to 7 days, depending on the patient's digestive power. If extended beyond 7 days, the sneha will become a diet and will lose its therapeutic value.
During the course of Abhyantara Snehapana, patients have to be on a controlled diet. They should abstain from heavy and spicy food, should not sleep during the daytime, should sleep well in the night, should not stop natural urges, and should not indulge in sex. When the Abhyantara Snehapana is perfect, certain symptoms can be noticed. These are proper functioning of vata, improvement in digestion, unctuous and loose stool, oiliness and softness of the body, fatigue and aversion towards further sneha. When these symptoms are observed, the snehana is called samyak snehana. Dry and hard stool, improper functioning of vata, poor digestion and persisting roughness and dryness of body are the symptoms of asamyak sneha or under oleation. In the case of adhisnehana or over oleation, the symptoms are the following: heaviness, dullness, anorexia, nausea, unformed stool, pallor, drowsiness, and a passage of undigested sneha material through the body orifices. Samyak sneha indicates that the impurities present in the body are well soaked with the sneha materials. Now, these impurities have to be expelled from the body by bringing them to the nearest orifice of the appropriate part of the gastrointestinal tract.